Welcome back. A Johnstown man lived with chronic nerve pain for years. It stemmed from a horrific motorcycle accident. Here's Bob Chismar's journey. Bob Chismar has been coaching the Shade Township High School football team for 5 years. It's something he wasn't sure he would ever do again. A ride on his motorcycle changed everything.
I was going up a hill and it's a bright sunny day. And of all things, you know, you wouldn't think this would happen in a million years, but it was another motorcycle. And we both sort of met at the center line and we just hit. And, you know, he went flying and I went flying. The accident it just tore my pants that it almost made them look like shorts. It just made a perfect cut and my leg was just gone.
Somehow, Bob was able to dial 911 on his cell phone. Then he called his wife.
His exact words, I remember, he said, "Chris, you're going to kill me. I wrecked the bike." And I said, "Oh my gosh, are you hurt?" And he said, "Yes, I think I lost my leg." And I said, "Oh, Chiz," I call him Chiz. I said, "That's not funny." Because he just sounded so normal, you know. And he said, "No, I'm serious."
And I said, "If you hurry up, I can hear the ambulances coming, I can hear the sirens." I said, "You know, you can make it down here." Because I just wanted her so much to be there because, you know, it would just make things so much better with her around.
And I saw him on the side of the road. And he was very coherent. He yelled for me. He was laying down. And as soon as I walked over, I saw, you know, his leg was missing.
Surgeons immediately took Bob into surgery.
We were still hopeful that they could save the knee. That's kind of, we went into surgery thinking that. And afterwards, you know, they said no, you know, that it's going to require several surgeries.
After Bob recovered, doctors fit him with a prosthetic. 4 months after the accident, he was walking. Then Bob developed phantom pain.
Phantom pain is a medical condition when a patient who lost, most typically a limb, let's say an arm or a leg, is continuing having pain in the limb that is absent.
I can feel my feet and my ankle and my toes every day.
There are areas in the brain that are responsible for feeling in that part of our body. And in spite of the fact that this part of our body is missing, the neurons, the nerve cells are still there. It's
amazing the power that your body can create. It's always like an electric shock, an intense electric shock that would make your leg just jump in the air.
He was experiencing the same type of pain that occurred during the initial accident when he had a motorcycle accident, which was sharp, shooting, really torturing pain related to severing the nerves and the extremity as a whole.
And when you'd get those 24-hour or 36-hour phantom pains, I mean, it was just intense because it affected your sleep and everything.
It just drained him, and he was on the couch. You know, we teased with him and said he turned into a couch potato, and you know, it just zapped his energy. He had no energy.
You know, you see him overcome this, and then you see him overcome, you know, walking again and balancing again, and he just overcomes all these obstacles, and then there's this one you can't get over.
After years of trying numerous medications and even surgery, doctors referred Bob to Hershey Medical Center.
When we had our meeting, the dorsal root ganglion, or DRG stimulation, was just being approved by FDA. So I immediately thought that he would be a good candidate, and I referred him to Dr. Sather.
So dorsal root ganglion stimulation is what it's called, and it's basically stimulation of the dorsal root ganglion, which is an enlarged part of the nerve that sits just outside the spine. So it's delivering very low-level electrical stimulation to that dorsal root ganglion, and that stimulation is blocking the pain sensation as it travels through, so it sort of filters out the bad information before it's getting up to the spinal cord and the brain.
It was going to be a stimulation that I would feel in the part of my leg that doesn't exist that would block this pain. And I said, boy, that sounds great.
I think we just felt like this is the answer. This is what we've been looking for.
I always tell patients it's a two-part procedure. So the first part is the trial, where we place the electrodes. So in Bob's case, this is the L3 nerve, this is the L4 nerve below it, and this is the L5 nerve below it. So he had a lead at place at each of these 3 levels.
One goes to my foot, one goes to my shin area, and one goes to my upper leg. So it's got everything covered. So it's really great how it works.
He has the ability to turn certain electrodes off, turn them all off, turn the whole device off, adjust the settings, higher stimulation or lower stimulation.
I knew like after the first day when I went home that it was working. I could feel it. They had a surgery set up for the following week that I could go back and get this put in permanently. So that Monday came and we said, let's do this.
Dr. Sather implanted the device permanently. What a huge difference such a small device has made for Bob and his family.
It's just been a godsend that, things went the way they did.
I have my dad back, I have the positive, goofing around, doing things with me again, like going on family trips. Everything that was before the accident is kind of how it is now, and it's a really cool thing to see.
He's like a different person. I keep saying I've got my husband back, the one that I married, the active one. He's a jokester, and his personality, it just rolled right around, to how he used to be.
And I'm just so happy how this turned out, because it's made such a difference in my life.
Bob says he has cut back on his pain medications. His goal is to get off of them altogether. Now joining us is Bob's doctor, Michael Sather. As we saw, Bob had great success with this. What else can this stimulator be used to treat?
Yeah, so Bob had a really great success with this. The good news is that not only phantom limb pain, but lots of other chronic nerve-related pain conditions can benefit from the dorsal root ganglion stimulator. So this includes things, for example, like peripheral neuropathy, postherpetic neuralgia, reflex sympathetic dystrophy, now known as complex regional pain syndrome, and peripheral causalgia, or other types of nerve injuries and conditions.
So a wide variety.
Wide variety.
Just fairly, I mean, it was just recommended or just approved within the past couple of years.
Correct, that's correct.
Okay, so you have a skeleton here.
Yep.
Tell us, how is it implanted?
Yeah, so I have a spine model here. So this is a 2-part surgery. So the first part is the implantation of the trial electrodes. So here in the spine model, the implantation of the trial electrodes would involve a needle placement through the skin between the bones of the spine, and then through that, this guiding catheter would be placed with the wire electrode in it, and then this would be guided out in between the bones and out through the nerve opening, which is here. And the dorsal root ganglion sits right outside of the nerve canal, the enlarged part of the nerve there, and that's where that stimulator wire sits. And then this comes right out of the skin, and it hooks to an external pack that we monitor for about 7 days, and then the patient tells us how it works for them, gives us a thumbs up or a thumbs down, and we move forward if it was more than 50% relief. And that involves then implantation of this battery pack here, which then sits basically right at the level of the belt line.
And what is the recovery like?
So in comparison to other types of surgeries and procedures, this is a fairly mild procedure. The recovery is about 6 weeks. The pain is pretty limited, pretty small amount of pain. And the success rate is variable from person to person. But in general, the trial will tell you what kind of relief you're going to get with a permanent implantation. So if you have a very successful trial, you're going to have a very successful implant. We know that about 85% people when they have a success with the trial, will have long-term success with the implant.
And we know that Bob wants to get off the medications. Is this typical for all of your patients?
Yes, I think it's very likely that Bob will get down on medications, if not off medications altogether, because of his high response to this treatment.